Hi, my name is Andrea Leonard. I'm a 33-year cancer survivor and president and founder of the Cancer Exercise Training Institute. My cancer journey began in 1981 when my mom was first diagnosed with breast cancer. And in the aftermath of her surgery and treatment, I saw so many debilitating side effects that could have been prevented. I began to do research, which took 3 years, working with the chiefs of breast surgery at Georgetown, GW, and Johns Hopkins, and wrote one of the first books that was ever written on exercise recovery for breast cancer survivors. Through the years, I've developed coursework to help fitness professionals be competent and qualified to work with cancer patients through the recovery process. The book that you're about to read or that you're reading alongside watching these videos is always going to be there for you as a resource. Don't try to memorize it. Learn how to resource information in the book. Figure out what applies to you as a fitness professional. Don't worry about memorizing definitions, but think about what does this side effect, what does this muscle imbalance have to do with the exercise programming, and how can I help to correct that? You will see the videos to follow that will go along with the handbook and show you how to do the proper form of the exercises on the BOSU Balance Trainer. Read through the book. You'll see a red stop sign with a hand, which will show you how to progress, how to regress sometimes, when to move on to the next exercise, and what exactly should be part of your recovery program. This is the exercise programming portion of the Breast Cancer Recovery BOSU Specialist Advanced Qualification. It's very important that you remember that you always do a warm-up prior to beginning any exercises. It can be riding an exercise bike, going for a walk, or in the best case scenario, they are actually going to be bouncing on the BOSU Balance Trainer. The beauty of that is that it simulates the same movement as bouncing on a mini tramp, and there have been many studies showing that that helps with the flow of lymph and lymphatic fluid. This will help us to help our client encourage lymphatic flow and prevent or minimize lymphedema. Every exercise that you see in your handbook is going to have a level 1, level 2, and sometimes level 3. And it's very important that you progress gradually, so make sure that they can do level 1 with no pain, no problems. When they can, then they can move on to level 2, so on and so forth. And there's going to be progression and sometimes regression. You may move on to level 2 and realize that they're not quite ready for that yet. So go back to level 1, do that for a while, and then they can always come back to level 2 at another time. So we're going to start all of our exercise sessions off with at least a 5-minute warm-up. You want to make sure that your client can tolerate even that 5 minutes. So try and determine what that intensity level is. We know what the duration is going to be, but you know, they can change their effort of exertion. So we're going to start off by having them step onto the BOSU Balance Trainer. Now, if you look at your book in level 1, you'll notice that you are going to be spotting them. And then they can even do it on the floor to begin with, just marching in place. But level 2, they can get on the BOSU Balance Trainer on their own, holding on to something, maybe a chair back or even a dowel for balance. But we want to make sure that they are not going to injure themselves. If somebody has peripheral neuropathy and they have burning, tingling, numbness, pain in their feet, we do not want them standing on the BOSU Balance Trainer, as they don't have the sensation, and it is a high risk for falling and then, of course, injury. Or if there are any other reasons that they should not be on here. If they have bone metastasis, fractures, anything that has an increased risk if they fall. So to begin with, we're just going to have them shift their weight. Nice and easy, engage their core, drawing in their belly button to the spine. Tell them to bring their shoulders back, keep their head in alignment, and they're not jumping up and down on the balance trainer. It's literally just shifting the weight. And even for somebody who considers themselves fairly fit, this is challenging. So don't be surprised if your client has to have something to hold on to begin with. So 5 minutes, start your warm-up, Make sure that they have no problems with that, and then the next exercise session you can increase it to 6 and to 7, so on and so forth. But don't take huge leaps in time. You don't want to go from 5 minutes to 10 minutes to 15 minutes, because at any point that might be too much for the lymphatic system to handle, and they may end up with lymphedema. At that point, we don't know if they would have been fine with only 6 minutes or 7 minutes, because we jumped all the way to 10. So start and progress slowly. We're going to begin with exercises to correct muscle imbalances that are the result of surgery and or treatment, and we will progress from there. Following your postural assessment on your client, if you've determined they have round shoulder syndrome, protracted shoulders, forward head, oftentimes people have that as a result of day-to-day living, but it is exacerbated by mastectomy scars, radiation to the chest, and then reconstruction. So we want to begin by stretching out the chest very gently. Level 1, we're going to start having our client sit on a chair and just begin with the stretches, but I'm going to move on to level 2, which is having them sit on the center of the BOSU balance trainer. There are various reasons that somebody may not be able to get down to the floor, and that's fine. Then they can just do this sitting in a chair. But we're going to begin by having them place their hands behind their head and explain that they should think of squeezing a tennis ball between their shoulder blades and gently push their elbows back and together. Now, some people may have difficulty just bringing their arms up this high, in which case a modification would be to have them place their arms behind them on the base of the BOSU balance trainer, bring their shoulders back and down, make sure they're not elevating them and that their head isn't jutting forward, draw their belly button towards their spine, and to hold that stretch. Taking deep breaths, deep diaphragmatic breathing, which will also help to encourage the flow of lymphatic fluid. And we want to try and have them hold these stretches for 15 to 30 seconds if possible, but realizing that every client is going to have a different level of tolerance, and it's going to depend on their fitness level prior to surgery and treatment, their age, and how they're responding to treatment, or if they are well on their way to recovery. So we start with this. If this is too much, we can modify it by having them place their hands on their side. So that would be level 2. If they can do this with no problem, there's no pain, there's no swelling thereafter, then we're going to move on to level 3, in which case we will instruct them to sit at the base of the BOSU balance trainer. And they're going to slowly roll back onto the dome. Now, if somebody's had an abdominal tram reconstruction, they will not be able to roll back, particularly if they had both sides of their rectus abdominis removed. All of these precautions are in your handbook. There's a little hand in red, so a stop sign. Make sure you read these precautions carefully with each of the exercises and follow them. So if somebody had an abdominal tram, they could very simply roll from the side onto the dome of the BOSU balance trainer. A modified version, much like we did sitting upright, where they place their hands behind their head and roll back slowly onto the dome of the BOSU balance trainer. Take nice deep breaths and expand their chest. And hold that ultimately for 15 to 30 seconds, but whatever they can tolerate. Alternatively, they can begin with their arms upright and slowly let their arms go out until they get a fantastic stretch across their chest. And then make sure that they engage their abdominal muscles as they roll up, or they can roll onto their side. One thing to keep in mind is if they've had breast implants or they have expanders, well, actually, if they have expanders, they should not be doing any chest exercises while the expanders are in. But once they've been removed and implants are in place, or if they've had a lat flap and they have implants, you're going to want to be very cautious about increasing range of motion. Do not encourage them to go all the way out right away, because those implants, it's a very delicate situation in which the implant can actually move out of its pocket. So not only do we want to gently work through the scar tissue and possible adhesions, but we want to prevent that from happening. The second part of correcting round shoulder syndrome, stretching the chest was first, is to strengthen the back and all the posterior muscles of the rotator cuff and work on shoulder stabilization. In the book, talking about level 1, we begin with no resistance. So whether they're sitting in a chair or on the BOSU balance trainer, we don't want to start them off with even the lightest resistance with a band. We want to make sure they can do the exercise with proper form, no pain, no swelling, and then we move on. So teach them the motion and retract their shoulder blades and have them bring their arms out to the side, squeezing their shoulder blades together. Have them go through that a few times. They can do it with a reduced range of motion. They can even do it simply retracting their shoulder blades. In your book, you're going to see I have a figure 8 band, but the one that most people will have will probably just be a regular band with or without handles. This one has interchangeable handles on it. It is so important that if your client is at risk for lymphedema, they've had lymph nodes removed or irradiated, that you do not have them wrap the band around their hand. This can reduce the flow of lymphatic fluid as well as circulation and increase their risk of lymphedema. So we're going to begin having them sit upright, draw their belly button towards their spine. Find a position on the band where, they may have to practice a couple times to see how much tension they require, or they may need to use a lighter band. Have them hold the band between their fingers. Again, do not wrap it around like so. And the figure 8 bands are great when you can get a hold of them. Their arms are just below shoulder height, head is in alignment. Retract the shoulders and bring the arms out to the side and slowly go back. And this may be as far as they can go, or they may be able to go all the way out. But focus on that negative, keeping them in control, letting that resistance slowly come together. And begin with a small number of repetitions. Maybe it's 2, 3, 5. Make sure that they can do that with no pain, no swelling. Then we gradually add repetitions. We gradually add more resistance. So as not to be redundant, I'm not going to repeat that sequence with every single exercise. Just remember to start and progress slowly. So now for level 3, I actually will have the client move down to the base of the BOSU balance trainer. Once again, same things apply with abdominal tram reconstruction. And they roll on down, they're over the dome. The arms come up overhead and they bring that band out to the side. Gently, slight bend in the elbows, abs are tight, belly button's drawn in. Exhaling out. Inhaling as they come in. I'm just going to do one more repetition. And this band is sliding a bit. It's a new band and it's slippery, so just make sure that you have something that they can manage very well. So those are our 2 sets of reverse flies. Next, we are going to move on to external rotation, with the focus once again being on the posterior muscles of the rotator cuff. So we would start this having them sit in a chair or on the BOSU balance trainer with no weight, and then of course moving up to weight, but I'm going to show you how to do it with resistance. When we're working on the BOSU balance trainer, we need to consider contact points. Right now I have 4 contact points, both of my knees and both sets of toes. If I want to create more of a challenge, a balance challenge, then what I can do is eliminate 1 or 2 of my contact points. So for example, if I take 1 set of toes off of the floor, now I'm down to 3 contact points, and you can see I'm not quite as steady. So if this were my client, I would probably have them put their foot back on the floor until they were able to stabilize their hips with only 3 contact points. So something to keep in mind as your clients progress and advance and they want something a little more challenging. I'm going to begin using these 2-pound weights. If I were working with my client, I would start with no weights and then go to 1, 2, 3, whatever increments I can get my hands on. Belly button is engaged, elbows are locked at the side, retracting the shoulders, exhaling as they go back, making sure that they don't bring their head forward or arch their back, and then slow on the return. Simultaneously, they are stretching their chest and they are strengthening and contracting their back. So through the process of reciprocal inhibition, as we contract the posterior muscles, the anterior ones have no choice but to stretch. So this is level 2. Level 3 will be done on top of the dome. Although I'm holding my weights, I would give them to my clients so they had one less thing to concern themselves with as they get onto here. And I would make sure that they have really good stability before giving them weights or a load. Knees should be slightly bent, belly button drawn in, head in alignment, shoulders back and down. And we do the same exact thing that we had them do while sitting, except now they're really working on their balance as well. Have them do a couple reps, see how they do, and then they can progress when ready. Next, we're going to move on to a bent over row. Now, the first option would be to do this in the chair. Secondly, they could actually do it while standing on the floor. And then for those who can handle standing on the BOSU with good balance, we're going to have them hinge at the hips, retract their shoulder blades, exhale, and bring those weights up to their hip bones, pinching their shoulder blades together. And so important to engage those abdominal muscles and have a strong core while doing this. And then they can carefully dismount off the BOSU balance trainer. If somebody has osteoporosis in the lumbar area of their spine, I would not have them do that particular exercise. Having finished our exercises for correcting round shoulder syndrome, we're going to now move on to increasing range of motion. You should have assessed your client through using a goniometer to determine if they have limited range of motion in flexion, extension, abduction, internal or external rotation. So if you find that they do have limited range of motion, you can flip through your book and go to the specific exercise to address that particular thing. So the first one we're going to do is the lat and axilla stretch. When they have an axillary lymph node dissection, they will have an incision under their armpit, and between the scar tissue and any potential adhesions, along with that of the mastectomy, it can truly limit their range of motion. They can start by doing this on the floor, which would be level 1, and then level 2, moving on to the dome of the BOSU balance trainer. So I'm going to go ahead and get down, but I would have my client slowly lower down, supporting their head, and then gently bring that arm up overhead. Now, some people may only be able to go to here, so instruct them to take deep breaths and try and reach a little bit further and a little bit further, wherever their comfort zone is. There should be no pain, absolutely no pain, just a mild stretching sensation. And they can also do this repetitively as opposed to holding the stretch each time, trying to reach a little bit further. But it's a nice gentle stretch, and then they can just hold it there, take some nice deep breaths, and when they're done, bring that arm back slowly and then work their way up on top of the BOSU balance trainer off the floor. Exercises for shoulder AB abduction. Start by doing this one with your client on the floor. That's level 1. And if they can do that with no problem, we'll move on to placing their foot on top of the dome of the BOSU balance trainer. They will rest their forearm on their thigh and then very gradually bring that arm up overhead and reaching as far as they can with no pain. Once again, they can do this through repetitions, smooth and slow, trying to reach a little further every single time, or just have them hold that stretch. And they should feel the stretch all through the lat area and the axilla. No pain. This should be a really pleasant stretching sensation. We're going to work on shoulder flexion along with an axilla stretch for that person who's had that axillary lymph node dissection, who has limited flexion. We do not want to put any load, no weight in a client's hands who does not have good range of motion. So when you did your goniometric measurements, remember that you had to be at 90% or better of the bottom number. So for example, if they were doing flexion and the norm is 150 to 180, your client needs to have at least 135 degrees range of motion before you would put a weight in their hands for example, for this particular exercise, which is a pullover. So we're going to begin assuming that they don't have the range of motion that we're looking for. First, have them do it on the floor. That would be level 1. As long as they don't have any problems with swelling or pain, then you can move on to level 2 and have them roll down on top of the dome of the BOSU balance trainer. Find that position where their head is supported, draw their belly button towards their spine, and then they'll raise their arms up overhead without allowing excessive movement in their lumbar region. So we don't want them excessively arching their back. Draw the belly button in, and they will let their arms go back over their head. Now, this may be very difficult for people to hold this stretch, so it is absolutely fine for them to do this repetitively, each time trying to go a little bit further. And for those of you who feel that active isolated stretching would be beneficial with your clients, this is a great place where they go as far as they can, and then you give them just a tiny bit more of a stretch, then they go back up to start, and you can repeat that however many times is necessary. Just remember, start and progress slowly. Going into shoulder extension, what I want you to think about is the person who has scar tissue, possible adhesions in the chest area. Remember, that would be compounded if they have also had reconstruction. So they've had multiple surgeries to that area. Think about how tight that is. And the more someone has round shoulder syndrome, the more difficult it's going to be for them to bring their arms back into extension. So we'll begin by having them do this on their floor. Neutral pelvis, belly button drawn into the spine, head in alignment, arms by the side, and bringing the arms back as far as they can without compensating. Make sure that they're not elevating their traps, nor do we want them arching their back or jutting their head forward. So belly buttons in, shoulders back and down, and they're going to bring their arms back as far as they can. They can either hold that or go ahead and do it repetitively. If they can do that with no problem, we'll have them get up onto the BOSU balance trainer. I always have my clients find something that they can focus on to get their center of gravity first and foremost. Soft knees, belly button drawn in, standing up nice and tall, and then have them bring their arms back and relax. If you happen to have a very lightweight dowel, maybe even a broomstick, you can have them hold it between their thumb and forefinger and also bring that up behind them. And then you can bring it up just a tiny bit more using active isolated stretching in that way. I'll give you another version of external rotation in a prone position. I would not advise this for somebody who has recently undergone surgery, as it will not be comfortable on their chest, and it may in fact never be comfortable. So obviously talk to your client, make sure they're not in any discomfort. If they kind of cringe when you show them this exercise, then just do the external rotation sitting upright. And bear in mind also, if they've had an abdominal tram surgery, they're going to have 2 contact points that may not feel very good. So we're going to get them into a prone position over the dome of the BOSU balance trainer. Toes on the floor, contracting the gluteal muscles, starting with their head down and then lifting up, arms at 90 degrees, drawing the belly button towards the spine, squeezing the shoulder blades together, and then they can hold that as long as possible. Relax and repeat that again. Make sure they're contracting the glutes, and then carefully come up off of that dome. So that one, like I said, may not be for everybody, but it is just a nice alternative to have in your arsenal of exercises. Combine shoulder flexion with core and balance. You would, of course, have your client begin on the floor and see if they can do this with no problem standing just on the floor before they get up onto the BOSU balance trainer. This is quite a balance challenge because we're going to be working through multiple planes of motion, gradually moving up to adding some resistance. I am using a 4-pound weighted ball, but please do not do that with your clients. Start with no weight, then go up to a 1-pound ball, 2-pound ball, 3-pound ball, so on and so forth. And remember that they need to have that full range of motion before we even consider giving them any type of resistance. So the first thing to do is to have them get their feet as close to shoulder width as possible on the balance trainer. When they're doing the squat, of course, you want to make sure that their thighs are parallel, that their ankles are stable. And the beauty of this is that they're also strengthening the tendons and the ligaments in their ankles, so that if they do fall, which of course we're going to work on balance and hope to prevent that, but their ankles will be stronger and less likely to become injured. So there are so many benefits from working on the BOSU balance trainer. So we're going to begin by having them look straight ahead, knees bend, the arms are down, they don't change their line of sight, and then they come up and they raise their arms up. Really important that when they're coming up that they don't arch their back, which is so easy and natural for most people to do. So nice breathing, and most people will not be able to get their arms all the way overhead to begin with. So that's the first, the start off exercise. Then, if you want to change it up a little bit, you can have them, the knees are still going forward, thighs are still going forward, but they go diagonal. And this one's really challenging. So I might have them do a couple on that side, and then a couple to the other side. Their legs are probably going to get a little bit shaky, so maybe give them assistance and have them carefully get off. Add some stretching along with shoulder flexion, so we're going to stretch our low back, glutes, and hamstrings. Begin by having your client do this on the floor, of course, and then level 2 would be to have them sit on the dome of the BOSU balance trainer. Legs crisscrossed. This will be our first way of doing it, but I will show you an alternative. Fingers on the floor. Have them keeping their sits bones down. Drop their head and slowly slide their hands out in front and hold that stretch. Nice deep breaths. Then instruct them to keep their weight back as they roll up one vertebrae at a time. For the person who's undergone an abdominal tram reconstruction, that of course would be very difficult. So either don't do that particular exercise, do the next one I'm going to show you, or they would have to probably dismount to the side. So alternatively, and this is where we get our hamstring stretch, they can have their legs in a V, drop their hands, and slowly go forward. And because we're not going to go as far, it's a little bit easier to come back up to an upright position, but still keeping those sits bones down, head drops, reach those fingers, pull the toes toward the knee. Nice deep breathing and slowly coming up. That can be done repetitively or just holding the stretch. Same position, we can move on to a stretch for the quadratus lumborum or the QL. Particularly if you identified a hip hike in your postural assessment, oftentimes the QL is the culprit. So with their sits bones in contact with that BOSU balance trainer once again. Now you can begin doing this on the floor first if you'd prefer, but keeping them in contact, they're going to reach their arms off to the side on this one. The key here is going to be to keep the opposing side down and not roll their body as they do this stretch. So they should reach down, drop their head, keeping this down, and then they should feel a really phenomenal stretch through here while doing this. And they can hold it on one side and then go on to the other, making sure to keep that knee down. And coming up nice and slow. And not everybody will be able to hold that stretch for 15 to 30 seconds, but that is going to be our goal. Clients present with tight hip flexors, they very likely have weaker gluteal muscles. So these next exercises will help to strengthen the gluteal muscles and simultaneously, because of reciprocal inhibition, will help to stretch out those tight hip flexors. Begin by doing these exercises on the floor, and when your client's ready to move on, then go ahead up to the dome of the BOSU balance trainer. I'm going to start by placing my leg in the center. That's my first contact point, second and third contact points, and we're going to start, my fourth contact point is on the floor with my extended leg. So be prepared as I lift that leg off, if I were your client, that they may become unstable at that point. In which case, you know, maybe they're not ready to go to the dome of the BOSU balance trainer and they stick with doing it on the floor. So you're going to have your client look down at the floor, draw their belly button towards the spine, start with their leg kind of inward, and then extend up with their foot flexed, keeping that neck in neutral. We don't want any strain on the neck, making sure they're not rotating their hips as they lift up. Only going back as far as they can, keeping everything smooth and centered. Okay, if this hurts their hands, they can come down also onto their forearms to do this. We'll have them do that on both sides. Realize also that if they are somewhat new, fresh out of surgery, it might be too much to have them support their body weight on either their hands or on their forearms. So this might be an exercise that you incorporate later on, several months into their recovery. Exercise will also focus on strengthening the glutes and stretching the hip flexors. Of course, we're always working our core when using the BOSU balance trainer. And the same thing's going to apply with your client as far as putting their weight on their wrists or their forearms and giving them an adequate amount of recovery time before doing these exercises. So just because they're in your book does not mean that they are for everybody at every stage of treatment and recovery. And you can modify things also with your own expertise. So I'm going to get in the same position, centering my leg, my knee on the BOSU balance trainer. My leg begins kind of parallel to the floor but bent at 90 degrees, and I'm going to try and keep my hips level, drawing in my belly button, and little tiny presses up to the ceiling. Now, people will have the tendency, once again, to rotate, and we want to discourage that. Just little teeny tiny movements, foot is flexed. It's as if they're pushing the ceiling upward, and they too can go down onto their forearms. Have them come up carefully, and then of course switch to the other side. Begin with just a few repetitions. Now, even though they're not at risk for lymphedema on their lower body because they had axillary or sentinel nodes removed in their armpit, still, you know, it's a new exercise to them, so make sure they can handle it, that they don't injure themselves. I'm more concerned with their lower back. And if they have had an abdominal tram reconstruction, their low back is probably already tight and the abdominal muscles either aren't there or are weak in response to the surgery. So it will be so critical to have them really engage the rest of their abdominal muscles, the external obliques, the transverse abdominis, multifidus, all of those good core stabilizers while they're doing that exercise. On with our gluteal strengthening exercises, which of course also focus on our core stabilizers. We are going to do some bridges. Start with your client doing this on the floor. We want to make sure that when they elevate, that their knees are as close to lined up over their ankles as possible. We want their head to be in neutral on the dome of the BOSU balance trainer. So I'm going to go ahead and roll back. Get that comfortable position and then bring my legs in. Now, when your client is doing this, I always instruct them to, at least initially, look at their legs, make sure their thighs are parallel. We don't want their legs bowing out to the side or caving inward unless we're doing that on purpose for a corrective exercise if they externally or internally rotate their hips. So relaxed, they're looking up at the ceiling, arms on the floor. I'm going to cue them by beginning with a Kegel, then contracting their glutes, pushing their heels into the floor, in fact, maybe even lifting the toes off of the floor, holding that up there. Belly button is still drawn in, thighs are parallel, and then slowly going down. Again, the cues, they do their Kegel, they contract their glutes, they push through their heels, they come all the way up, maybe hold it 1 to 3 or 3 to 5 seconds, and down. And then when they're done, I will have them bring their knee in one at a time, or even both knees at the same time to decompress the spine and stretch the back out. I'll give you another variation of bridges. So I've flipped things around now. My head will be on the floor. My feet will be up on the dome of the BOSU balance trainer. One isn't necessarily more challenging than the other. It's just different, just some variety. So I'm going to go ahead and roll back. If I had an abdominal tram reconstruction, I would have to roll from my side up onto the BOSU balance trainer. Have your client bring their rear end all the way up against the base, bring their feet in centered, and then arms by the side. We're going to go up, contracting the glutes. Thighs are parallel, holding it up there, and slowly going down. Again, Kegel, contract the glutes, push the heels into the BOSU balance trainer, and up. If you really want to give them a balance challenge, so if I remove one of my contact points here, and I push straight up and down, doing a one-leg bridge. And then, of course, alternate on both sides. And then when your client is through, have them bring their knees into their chest, stretch their lower back out, and then they can roll up. Nice and easy. This exercise is entitled Superwoman, but it is also traditionally the bird dog pose. Begin by having your client do it on the floor, starting off in a quadruped, and then move on to the bird dog position. I'm going to go ahead and contact with my knee to the BOSU balance trainer, get my hands in position on the floor. So right now I have 4 contact points. I'm about to remove 2 of them, which of course is going to make this quite challenging for the average person. So let's begin with just removing 1 and see how your client does. Then you can go on and have them remove the other. And you can see I start to get very unstable very quickly. So you're having them make sure they're not rotating their hips. The gluteal muscles are contracted. You can either flex or point the foot. It doesn't really matter. And then go ahead and have them switch sides. Now maybe this time I lift off my contact point in the front first, which actually feels more awkward to me. So I'm going to go ahead and raise my leg out first, drawing the belly button toward the spine. And then this side I'm much less stable on, which means I need to do some work. And then go ahead and roll up carefully. And, you know, even for somebody who is a fitness professional, that is very challenging. So they may only be able to do 1 rep if they can do 1 at all. Slowly, gradually progress. Same thing applies as far as putting their body weight on their wrists and supporting themselves with their arms. So work into that one slowly. Focus specifically on our obliques now, and this is a great exercise for somebody who has had an abdominal tram because their rectus abdominis are no longer functioning either the way they did before or at all in the case that they've had both rectus pedicles moved to reconstruct the breasts. So strengthening the obliques becomes really important, particularly for helping to protect their low back. So this is a really easy exercise. We can start by having them do it just seated in a chair, and if that goes fine, have them center themselves on the BOSU balance trainer. And what I always say to people is to pretend they have a little ball. So, you know, I have my weighted ball here, but for starters with clients, I'll have them just make believe and hold it there. But what I tell them is to go from 11 o'clock to 1 o'clock. Slight bend in the elbows, looking straight ahead with very little movement in the torso, and they should really feel that in what they're going to call their waist. Now, if they're holding the weighted ball, then that becomes resistance. We put a load on there, and since their arm is at risk for lymphedema, if they've had lymph nodes removed or irradiated, as soon as I add that weighted ball, I have to really be careful how many repetitions that I have the client do. But without the ball, then they can do many repetitions. What I might do in the end is just have them pump that affected the hand on the affected arm to just help circulate the lymphatic fluid when they're through. A fantastic exercise for the obliques is an oblique side bend. Start by having your clients do this on the floor, make sure they can do that with no problem, and then we really maintain the same position except we're elevated up onto the BOSU balance trainer. So even though it's not a huge change, we still add that element of core stabilization and just a little bit of balance as well. Their one arm is supporting them on the balance trainer, the other arm is behind their head. Have them maybe touch these muscles to begin with so they can assimilate what it is that they're trying to contract. The majority of people don't have very good kinesthetic awareness, so educating them on which muscles they're working and helping them to understand what that feels like is a really big part of training somebody. So take a nice deep breath, they bend and squeeze, they should feel that pinch right there, and slowly releasing. It is a very small movement. Focus on the breathing, looking straight ahead. Okay, and have them do however many they can on each side. Now, although doing the side crunch is not necessarily going to be exhausting to them, although it might, supporting their body on the affected arm, whichever side that is where you really have to take precautions. So even if they're not tiring in their abdominal or oblique area, try and start with just a few repetitions on each side so that they're not putting their body weight on the affected arm for very long. I'm going to give you a spin on the basic crunch. If your client has had an abdominal tram reconstruction procedure, do not do this exercise. Even if they have half of their rectus and they're still able to, it makes no sense. It's going to create even more of an imbalance. So for those folks, we're going to focus on the oblique exercises and the other core exercises that we've covered. Begin by having your client do a basic crunch on the floor. Hands behind their head, knees bent, chin up to the ceiling. Begin with a few repetitions. Make sure they can do that with no discomfort. If somebody has excessive forward head, that would be another reason I would not have them do crunches, because this is just going to exacerbate that muscle imbalance. There are other exercises that they can do that will be better suited to their postural deviation. So they've done the regular crunches. Now what I will have them do is back up with their tailbone against the BOSU balance trainer and gradually roll back. They're going to place their hands behind their head, elbows out to the side, chin up to the ceiling. So they're not tucking and they're not tilting back. Trying to open up their arms might be challenging, particularly with scar tissue across their chest, but they are also getting a stretch. They can contract their shoulder blades, which will help to stabilize their shoulder girdle, stretch their chest, and allow them to do the crunches with good form. So they exhale up and inhale back. And have them do however many repetitions. These are also, crunches are also our beginning exercises in the lymphatic drainage series. So if you flip up back to your lymphatic drainage exercises, we always start with crunches and a pelvic tilt. So if you want to incorporate the BOSU balance trainer for the crunches for that, that's fantastic. They can also do the pelvic tilts while they're in the same position. So level 3 for the crunch exercise is going to be to add a weighted ball. And this is definitely for somebody who is pretty well advanced in their exercise programming and has really good abdominal strength and wants to challenge themselves. So in this case, they're going to place the ball underneath their chin. It's kind of like a grapefruit between their chin and their chest. Holding the ball here, they're going to roll back and then do their crunches. And they're exhaling up, inhaling back. Okay, and I'll just do a few of those. From this same position, we can go to opposite elbow, opposite knee. Now we are incorporating our obliques here, but it's going to have the same issue with the people who've had their abdominal tram reconstruction procedures and not having that rectus abdominis muscle. So even though this incorporates obliques, this would not be an exercise that I would use for that population. So we get into the same position, only now go opposite elbow to opposite knee. and do however many repetitions you think are appropriate and how many your client can do with comfort. Next exercise is the V-sit, and the same implications for people who've had an abdominal tram procedure. This would be a really challenging exercise. In fact, this is a really challenging exercise anyway, and I have just found out that I can't even do the advanced level on my own. So it's going to take somebody who's really strong and coordinated. But for the first one, what we're going to do is have our clients lean back, chest out, shoulders back. They lift their legs up and then extend them. And then everything comes together and everything goes apart. This is quite a challenging exercise. In your book, it involves bringing the arms and legs apart, and I think I'm going to have to practice that one for a while before I can actually film that and not look completely ridiculous. But you guys practice that on your own before you even encourage your client to attempt that. Other than that, stick with the basic one. It's a fantastic abdominal exercise. Finish off this section with a twist on the traditional plank. Now let me preface this exercise by saying once again that if your client has recently undergone surgery or treatment, this exercise is not for them. This is for somebody who is several months out, and you must start and progress slowly, because the same thing applies. If they are at risk for lymphedema, putting their body weight onto their arms is going to pose a challenge and increase their risk for lymphedema. So even if they are really strong in their core, you still don't want to have them hold this for very long. Start with 5 seconds, then move on to 10 seconds, 15 seconds, so on and so forth. We can also modify this. So let me show you. First of all, we're going to set up, and in the picture in your book, I'm showing you a standard plank, but you can have your client modify that on their knees, drawing their belly button into the spine, keeping their head in neutral, contracting their glutes. Then if they can tolerate that, then they can go up again, contracting the glutes, tight abs on their toes, and only have them start by doing that for a few seconds at a time. See how they do, then gradually progress. Section is about balance, but quite frankly, everything that we're doing on the BOSU Balance Trainer is focusing on balance as well as core. This is pretty much, I would consider it a challenging exercise. First, begin by having your client do this on the floor, and I would hold the back of a chair and simply have them extend their leg out, very small bend in the knee, keeping the heel of the working leg in contact with the floor, and just see if they can do a one-leg squat. And this may have also been part of your assessment protocol. If they can do that, then the next step is to get them up on the BOSU Balance Trainer with the chair for balance, or you can hold their hands to do it. And then for those who are at that advanced level, the next thing is going to be to do a one-leg squat on top of the dome. Now in doing so, whatever they need to do with their arms to maintain their balance, and I have them simply lift their toes off of the balance trainer to begin with before actually lifting their entire foot off, and then simply putting the emphasis on the working leg, doing the one leg squat, making sure that knee is tracking properly. If they can do this with success, which I think will be a challenge for most people, they can even hold a weighted ball out in front of them while they do that. So just remember, everything you're doing on the balance trainer is working balance and core. This is just more of an advanced, challenging exercise. When completing your client's postural assessment, if you happen to notice that they have winged scapula, usually it is the result of the serratus muscle not firing properly. And following an axillary lymph node dissection, there may be a temporary ceasefire of the long thoracic nerve that manifests as winged scapula. So what we want to do is strengthen the serratus, and simultaneously we'll be stretching out the rhomboids. So this next exercise is called a ceiling punch. I would begin by having your client do this on the floor, of course, as we do with everything. And then the next progression is going to be to have them roll back onto the dome of the balance trainer. Just to remember that if they've had an abdominal tram reconstruction, that they'll have to go sideways onto the top as opposed to rolling down and using their abdominal muscles. So we're going to have their tailbone at the base of the balance trainer and roll on back. They may move out further afterwards so their head is supported. Arms are straight up, belly button's drawn in, knees are stacked over the ankles, and simply lifting their fingertips up to the ceiling and down. Exhaling up, inhaling down, and you should see my shoulders lift off of the balance trainer. Now, as they progress, if you want to add some resistance, remember this is a 4-pound ball, so I wouldn't jump right to that. We'd go 1 pound, 2 pound, 3 pounds, so on and so forth, and that they can add some resistance on this. And then for a greater balance challenge, if we remove a contact point, for example, 1 foot off of the floor, they're working a little bit more on balance and stabilization. Another great exercise for somebody with winged scapula, and although I talked about it being the result of a ceasefire of the long thoracic nerve following lymph node dissection, but it could be just day-to-day living, and I have a little bit of winged scapula and I did not have that surgical procedure. So this next exercise is a Serratus push-up. First I'm going to show you how to do it against the wall, which would be level 1, and then level 2 we'll progress to doing it on top of the BOSU balance trainer. So once the client is going to place their hands on the wall, their fingertips should be level, basically with the top of their shoulders. They're going to be positioned up on their toes. And the difference between this and a regular push-up is with a regular push-up, we stop just short of locking out our elbows. On this one, we actually want to see them extend completely, creating somewhat of a cat back. So I'll show you an example. Of course, my abdominal muscles are engaged. I have my nose come down to the wall, I push up, and here's where I go beyond that slight bend, and I extend back. Nice and controlled, going down, and then extending back. So I don't know if you could see the curve in my spine as I pushed off, but that is what we're looking for. In fact, I might place my hands on the client's upper back and have them think about pushing against my hands. Next, I'll show you how to do this on the BOSU balance trainer. This level 2 Serratus push-up on the BOSU balance trainer is more advanced, of course. It takes a little more strength and skill, but also bear in mind if somebody has just had surgery, let's say within the last 2 months, that they may not be ready to support their body weight on their arms. Also, this is more of a challenge for the person who is at risk for lymphedema, where we're not supporting our body weight necessarily, doing it against the wall. So take into consideration those things as you are determining whether or not you should progress to this exercise. So this specific push-up we'll have them do on their knees, which will minimize the amount of body weight that they're supporting. Inhaling down, coming down, touching the dome, and then exhaling. And here's where I'm going to push all the way up, arching my back, if you will. Inhaling down, exhaling up. Now, I'm actually doing it without my toes touching the floor, which poses a greater balance challenge. But for more stabilization, have them touch the floor with both sets of toes. Then they can begin by taking one set of toes off. And then, if they're ready, they can go ahead and minimize both contact points of their feet. This section is on lymphatic drainage. So for your clients who have had lymph nodes removed or irradiated, they are at risk for lymphedema. We want to begin and end each exercise session with these lymphatic drainage exercises. So you can instruct your client initially and then encourage them to do it on their own. And they can do this every day of the week, several times a day if they'd like. It's just going to help increase the flow of lymphatic fluid. So always begin with a short warm-up. If you go back to our first video where I was gently bouncing and redistributing my weight on the BOSU, that's fantastic because it does simulate bouncing on a trampoline, and that has been proven to help with lymphatic flow. Alternatively, they can get on a stationary bike, they can go for a walk, even walking up and down stairs or simply marching in place will suffice. But make sure that they do a 5-minute warm-up, getting everything ready for the following stretches. So we're going to go through a series, beginning with neck flexion. I'm going to instruct my client to tilt their chin to their chest and then gently place their hands on the back of their head. You want to make sure that they're not pushing down, so it's just the gentle weight of their hands. Each of these stretches should be held for, I'm going to say 15 to 30 seconds, but I would say no less than 15 seconds. I know time is an issue for a lot of us, as it is for our clients. But if you do it for too short a period of time, it's not going to have the benefits. So first we do forward flexion, and then what I'm going to instruct my client to do is bring their arm behind their body. If they cannot do that, they don't have the range of motion, then simply instruct them to place it as far back as they can. But I'm going to go ahead and place it behind. Then depressing this shoulder, so you may have to remind them to keep this shoulder down. They're going to tilt the ear to the other side into lateral flexion, and then once again just gently put their hand basically over their ear on this side, and they should feel a fantastic stretch through here, and then of course repeating that on the other side. So the first two stretches, forward flexion and then lateral flexion. Following 4 exercises that I'm going to show you, level 1 is going to be doing it on the floor. So making sure that they're comfortable with the exercise itself, and obviously that they can manage to stand on the floor for that given time. Once they're ready to progress, we're going to have them up on the dome of the BOSU balance trainer. These exercises should be done in the order that I'm showing you. So we started with the neck stretches. Now we're moving into some more dynamic movement. And although there is a stretch factor in this, it's not entirely just stretching. So we're going to begin with shoulder shrugs. And make sure that your clients are actively elevating their shoulders as well as depressing them. Nice and slow. Don't have them use a lot of momentum. We want this to be really, they want to engage this contraction at the top and even at the bottom. You're going to have to determine how many of these is an adequate number for your client, and that may depend entirely on their ability to stay up here on the balance trainer. So if at any given time they are wobbly or they seem to really be uncomfortable on the balance trainer, simply have them go down on the floor and finish up. Okay, so we just did the shoulder shrugs. Next, we're going to have them bring their arms out to the side for shoulder circles, for shoulder rotations. And we'll have them do several in each direction, both clockwise and counterclockwise. Now, while I'm doing this right now, I'm engaging my abdominal muscles, pulling my navel to my spine, keeping my knees slightly bent. And these are the things you're going to want to check for your client. Many people who have undergone these surgeries and radiation will not be able to hold their arms up here for one of 2 reasons. The first of which, their abduction can be affected by the surgery and radiation, and they may not have the full range of motion back yet in order to get their arms up. And secondly, it may be painful and they may not be strong enough to hold them here. Never force your client to do something that causes them any pain or discomfort. It's better off just skipping that particular part of this sequence. Okay, so we did the shoulder shrugs, we did the shoulder rolls. The next thing that we're going to do is an isometric contraction, where they're going to bring their elbows out to their side and contract their shoulder blades together. Make sure they're not extending their head out, that they're not arching their back. Everything should be in alignment. If your client has high blood pressure, be aware that an isometric contraction will raise their blood pressure. It is so important that you make sure that they are not holding their breath, as that is the culprit. So you can either have them hold it for simply 1 second and release, or ideally, I would love to see them hold it for 3 to 5 seconds with you making sure that they are actively inhaling and exhaling. And you will have to determine how many you think is a safe and effective number. I like to go for 8 to 10, but if your client can't do that many and it's a strain, it's fine to start with a lower number. And then following those back contractions, we do the exact opposite. Get in prayer position with the hands at the sternum, and they're exhaling as they're pressing their hands together, activating the pec minor, which of course helps with the flow of lymphatic fluid, and then releasing. And press their hands together and release. The last part of our lymphatic drainage series is simply a fist pump. So we're going to have them raise their arms up overhead. Now we've already distributed the flow of lymphatic fluid by using these other exercises in the sequence that they were given. And now we elevate the arms. We use gravity to help send the lymphatic fluid back to the torso, if you will. So very simply, just squeezing their hands, that pumping action. And I love to have my clients do this exercise in between weight training exercises. So let's say I have them doing bicep curls or rows. In between sets, I'm going to have them raise that affected arm and just pump it for a couple seconds. Just help with that lymphatic flow. In closing, I want to remind you that lymphedema can happen any time after lymph nodes are removed or irradiated. It could be 5 minutes later, or it could be 59 years later. The risk does not increase or decrease based on time. The factors that will play a role in increasing the risk will be a higher percentage of body fat, and adipose tissue interferes with the flow of lymph. As your client increases in age, that will also increase their risk. And lastly, poor nutrition. But those three things are only if they're already at risk for lymphedema. So make sure that you're educating your clients on how to prevent lymphedema, and then in the event that they do have lymphedema, that you're making sure that there is no additional swelling. We don't want the symptoms to get worse. When your clients have adequate range of motion, as I mentioned earlier, 90% or better of the lower number. So for example, with flexion or abduction, the range is 150 to 180. So they need to have at least 135 degrees of motion in those particular planes of motion before you can add any resistance to exercises within those planes. So the next section is going to be on strength training, and you will pick these exercises according to what postural deviations you are trying to correct. So this first one is the chest fly, and it has the benefit of stimulating the pec minor, which helps to increase the flow of lymphatic fluid, and then also we're stretching the chest and strengthening the back. You want to avoid any type of pushing activities like bench press. It's okay to do the Serratus push-ups. There's nothing wrong with that, but no loading, no bench press, no incline, decline press, because that only encourages that round shoulder syndrome and strengthens those muscles in that shortened position. So opening up the chest is what we're trying to accomplish. And even as I'm doing these chest flies, I'm going to engage my back muscles, squeezing my shoulder blades together, and through reciprocal inhibition, that will help my stretch in the chest even more. So level 2, I'm simply going to roll back onto the balance trainer. If somebody is unable to roll back for abdominal tram or other reasons, they can go up sideways. And I will begin by supporting my head, arms above, and I'm going to start with just a very small range of motion. Now remember, if they have implants, that those implants are going to move as they're doing this exercise. So we don't want them to first repetition go all the way out to here and realize, oops, that was too far. So just like we're going to progress with resistance, we're also going to progress with our range of motion. So level 2, I'm going to use a weighted ball. This ball, I keep telling you, is 4 pounds, but you can start your clients with a 1 pound ball, 2 pound balls. This would be way too heavy for somebody doing this for the first time. And they begin with their arms in center position. One arm goes out to the side and then back in. Now your clients may want to open up their feet to give them a better base of support, and then they go to the other side, making sure that the elbow remains slightly bent and that the wrist is as straight as possible while holding this ball. For a greater balance challenge, they can either lift the toes or the heels off the floor, or in fact, one leg altogether. But they're definitely going to have a good foundation and core strength to do that. And lastly, with level 3, I'm going to trade in my weighted ball for 2 individual weights. These are 2 pounds. You want to start your client with 1 pound, then 2, then 3, so on and so forth. And I tell them to think about hugging a barrel. Notice my fingers are loose. I'm gripping between my thumb and forefinger. I tell people not to have a hard grip on the weights because that also will increase their blood pressure. So nice and slow, big stretch, squeezing their armpits and coming back up into a barrel hug. And then always bring the weights back to the chest. We don't want them dropping the weights out to the side, as that poses a risk for a shoulder injury. Next exercises for chest strength are push-ups. Now, you're only going to have somebody do this if they have corrected their round shoulder syndrome and they have good posture. There's a balance between the front and back. Otherwise, I would not advise this. Also, we need to consider the fact that they may or may not be at risk for lymphedema, and start and progress slowly. Even with no weights, only do 1 or 2 push-ups to begin with. They're still putting all that body weight on the affected arm, and it is so important that you hear this and only do 1, 2, 3, progress one at a time. First off, you'll have them try it on the wall, much like I did with the Serratus push-ups, except in this instance, we're not going to have them expand across their back. It'll just be a regular push-up to slightly bent elbows and repeat. Of course, keeping their back flat, abs engaged, and making sure that they have good form, no pain. If they can do that and you've progressed accordingly, so maybe they're doing 10 or 12 of them now with no pain, now we're ready for more of a challenge. We're going to flip the balance trainer onto the other side. Now, there is a warning on here that says do not stand on top of the BOSU balance trainer, which we will not do. But for this exercise, this is just fine. There is no risk of injury from falling. So we're going to have our clients line themselves up. I actually like to hold where the handles are. And notice my feet and knees are both in contact with the floor. I'm going to tuck my rear end under and draw my belly button in and lower down and then squeeze through my armpits. Now, I feel that I need to move up a little, and your client may need to adjust their positioning as well. So I'm inhaling down, exhaling up. If I want a bigger balance challenge, I can lift 1 set of toes up and or 2, and slowly and gradually progress to more repetitions. 3 push-ups are advanced. They are very challenging, and you're going to have somebody who has a good, strong core, who is well on their way to recovery with incisions and months past treatment. And again, they have full range of motion. Their posture is good. They do not have round shoulder syndrome. So we're going to flip the BOSU back over, and now it is going to be under their feet. So I'm going to center my feet like so. I'm going to contract my glutes, draw my belly button to my spine, and come down and up. Slight bend in the elbows. Exhale up. I'll do 1 more for good measure. And then have them come down nice and easy and come up slowly so that they don't get dizzy when doing that. Move on to squats now. First, you're going to have your client perform a squat on the floor and make sure that they can do it with good form, that their feet are about shoulder width apart, feet are going forward, and that when they go into a squat, they're able to keep their chin level. Their thighs are parallel. Everything is tracking in the same line. We don't want to see their knees caving in or bowing out. And if they do, then you can correct that with some manual resistance by applying resistance in the opposite direction in which the knees are going. So begin by having them hold on to the back of the chair or a countertop, something stable that they can do the squats on. Then the next step would be to do the squats on the floor without the chair. And then lastly, we're going to have them get their BOSU balance trainer. Notice I have the pointed parts going forward and backward so they don't interfere with my stepping. Not that they necessarily would. But I'm going to place my foot going straight forward on the center of the BOSU balance trainer, and the other foot is in alignment, and both thighs are moving forward. and then go into a squat like so, and do say 6 to 8, 8 to 10 on each side. Tell them to push through their heels. Think of lifting their toes up and to contract their glutes, drawing their belly button in the whole time they're doing it. On to squats with hammer curls. So we're incorporating some arm movement and also strength training for the arms. We want to make sure that we start with 1 pound, then move to 2, 3, and so on and so forth. I'm using 2. And doing these compound exercises will help them to maximize their time because they're getting 2 things done at once, and they'll also burn more calories. So we're going to get them with their feet just about shoulder width apart on top of the BOSU Balance Trainer. And as they sit back, they contract their biceps simultaneously. So I try and encourage people to keep their elbows close to their body. They tend to migrate out to the side, keeping their wrists stiff, their eyes looking straight ahead, chin in neutral, pushing through the heels, contracting their glutes and drawing their belly button in. Now, even if they're able to do 50 of them with their legs, remember, we have to start and progress slowly with the upper body if they are at risk for lymphedema. So following the squats with hammer curls, we're going to move that BOSU out, and we're going to go into angled curls with plie squats. So my foot positioning is slightly different. My legs are turned out, as are my arms. Arms are still locked at my side. Wrists are stiff as a board. We don't want to see this with their hands. So I'm going to exhale as I go down, inhale up, and I'm going to check myself and look to make sure that my knees are lined up over my ankles. I'm sitting back very slightly. My chin is in neutral, drawing my belly button to my spine, and I'm emphasizing pushing up through my heels. If that is too difficult, then like we always do, begin or go back to doing them on the floor. Exercise we're going to do are tricep kickbacks. Now, this is fantastic, of course, for toning up the triceps, and women always complain about having saggy triceps and, you know, when they're getting ready for summer and all that good stuff. But the other thing to think about is that this is extension. So we want to make sure that they had full range of motion in extension before we place a load in that plane of motion. And we'll begin by having them do it on the floor, hinging at the hips, keeping their neck in neutral, lifting their elbows up, and then instructing them to push straight back. Now, if this puts any stress on their lower back, then we don't want to have them do this exercise, or we have them do it sitting in a chair. Now, obviously, if you're at a gym, you have all kinds of other possibilities as far as doing kickbacks, tricep press downs, straight arm press downs, skull crushers. But for the purposes of doing them on the BOSU, we're limited to the positioning that we can do. So if they can do that, no pain, no problems, then we're going to move on to the top of the BOSU Balance Trainer. Get our footing, hinge at the hips, knees are bent, neck is in neutral, elbows are going to be anchored, and they are going to extend their arms straight back, making sure there's not much movement, if any, at the wrists, and that they're getting a full contraction at the end of the motion. And then instruct them on how to roll up nice and slow, engaging their core, rolling up one vertebra at a time. Another great exercise for the triceps, I'm going to call skull crusher. We're going to begin by having our clients do this on the floor. Their back is flat, their knees are bent. I'm going to do the same thing now, rolling back onto the dome of the BOSU Balance Trainer. I have my 2-pound weights, but you're going to start your client with 1 pound and then progress to 2, 3, 5, whatever the increments are, and roll back carefully. Of course, they can roll sideways if they're unable to roll back on top. Really important with these exercises that you always begin with the weights in the center of their body, because if we have a client pulling from away from their body or lowering it away, if you think of the lever system, this puts so much more tension on the shoulder joint. So we want to bring that back in and then bring the arms up. So the hands are not going to be touching, the arms are going to be parallel, straight above the head. belly button's drawn in, and we're going to have them bring their hands back to their ears and push straight up. Inhaling back, exhaling up, making sure that the humerus is staying perpendicular. And then when they are through, they're going to bring those weights back in and place one down, then the other, and then come up slowly and one vertebrae at a time. Exercise we're going to focus on is going to really work the gluteus medius. If you did the Trendelenburg test with your client and you noticed that your client, the other hip sagged or dropped, then they usually have gluteus medius weakness. And this is such an important muscle in gait and everyday just activities. So we're going to begin by doing this on the floor without the balance trainer. That would be level 1. But level 2, we're going to go ahead and get up on top with our torso. The feet are stacked, the knees are stacked, and very simply lifting one leg. Now, we call this the fire hydrant in the book, but it's also known as clam. And you want to teach your client what that contraction feels like and try and keep them from using a whole lot of momentum and really get them to squeeze. And of course, they'll do this on both sides. Now, another thing you can do is take a circular band and place it around the top of their knees. So we're getting a little resistance now, and of course you can start with a yellow band, green, red, so on and so forth. Get in the same position, and now they are actually pulling against this resistance, slow and controlled throughout this range of motion to get a really great gluteus medius workout. Our next exercise is leg lifts, and we're still focusing on gluteus medius as well as the other abductors. If your client has a tendency to be externally rotated in the hip area, then you don't want to do this first part that I am showing you, as that will just exacerbate it. So for the leg lifts, you're going to position your client in a straight line. The bottom leg is bent for stability. Make sure that their anterior superior iliac spine is tilted slightly forward. We don't want them rolling back when they do this. Belly button is drawn in, and I like to have their toes pointed down slightly and raising their foot. So level 1, we'd be doing this on the floor. Level 2, propped up on the BOSU balance trainer. And if you want to put the band around their knees, above their knees, just like we did with the clams/fire hydrants, that will give them some great resistance to work against. And then something else that's not listed in your book, but you can add this as well. So for the person who is externally rotated in their hips and we want to strengthen their internal rotator, so we want to do adduction, let's just switch it around. So bend that top leg over the bottom straight leg. The bottom foot is flexed and we're having them lift upward. So they're working in adduction now as opposed to abduction, still drawing in the belly button, trying to keep their spine in neutral. And because they don't have any limit to what they can do with their lower body, other than their upper body getting tired from being across the BOSU, you can have them work to fatigue and really challenge themselves. Do it on one side and then of course switch over to the other. Lunge is another fantastic compound leg exercise. It's also, I love the lunge and the squat because they're more functional. Things like leg extensions and leg curls, while they may have a purpose, particularly for correcting muscle imbalances, we're not getting as much done. And the fact that these are closed chain is also beneficial for the client. So we're going to begin our lunges by having our client do them on the floor and holding onto a chair for support and balance and making sure that they can do them with good form in that position. Then level 2 would be to eliminate the chair, still doing them on the floor. Level 3, we move on top of the BOSU balance trainer with one of our legs, making sure that the foot is going forward. I'm going to go ahead and get in position with my back leg, but I want to explain something as well. If your client has tight hip flexors, they're very likely to also have weak glutes. So if this exercise is done with deliberation and really focusing on contracting the glutes, with that process of reciprocal inhibition, we will simultaneously stretch out the hip flexors. This is just an all-around great exercise. Getting into position is a little bit challenging, so you can of course assist your client, and I can scooch my leg back as much as I need. I'm going to tilt my hips under, which is going to put me into an already stretched position in my hip flexors and contracted in my glutes, and whatever they need to do for balance. Now they can go as low as they feel comfortable, so I suggest just doing a small movement, and then as they become stronger they can go into a deeper lunge. But most importantly, make sure the knee is lined up over the ankle and that the hip is lined up over the knee on the back leg. Sometimes people have a problem with the back leg being up on their toes for different reasons. One, maybe they have peripheral neuropathy and there is pain in their foot upon doing so. Do not do this exercise or any others if that is the case. The other thing about standing on the BOSU balance trainer, if your client has peripheral neuropathy, they don't have the sensation that they normally would. Pain may be part of the equation, but the other part is that they are not aware of the surroundings with their feet. So with the clients with peripheral neuropathy, for now, I would do these exercises all of them on the floor, and then work up to the balance trainer where they have to stand on the balance trainer if the peripheral neuropathy improves. Exercise, and our last exercise in the leg segment, is abduction. I'm going to remind you again, if your client is externally rotated, then you don't want to do this exercise, as that will just exacerbate it. So first we have them do it on the floor holding onto a chair. Then we have them do it on the floor without a chair, and then moving on to the balance trainer. And this does take quite a lot of coordination and balance. So the first thing is to get the one foot centered in the middle of the balance trainer and kind of have the other foot as a brake, if you will, or a kickstand. Find their balance, and I'm going to start by just having them lift off ever so slightly. Slight bend in the supporting leg, and the other foot is flexed, and there's going to be a lot of fumbling while they do this. So as they get stronger, they can begin to raise that leg out to the side more. But you may have to progress and then regress a little bit and go in steps to work up to that. And then of course we'll have you repeat that on the other side. And this finishes the strength training section, and now we're going to move on to the cool down. 4 exercises in our cool down, and you can use one or all. I would also suggest after these, if your client is at risk for lymphedema or they have lymphedema, then go ahead and go through the lymph drainage exercises again as kind of the cool down to the cool down, if you will. So we're all familiar with the cat back, and you can have your client do that on the floor initially, and then go ahead onto the top of the BOSU balance trainer. Right now I have 6 contact points, so if I want it to be a little more challenging, I can remove 2 of them by lifting my feet up, but I'm going to start right here and just pushing my spine up to the ceiling and then flattening out. We want to try and avoid sway back and just go to neutral and then up to that cat back. From there, we can have them go right back into a child's pose, dropping their head, walking their fingers forward as much as possible. And I want to hold this stretch for 30 seconds and then have them roll up one vertebra at a time, realizing that if they've had an abdominal tram, that will probably not work out for them. Next, I'm going to move the BOSU balance trainer forward. I am going to support my lower torso on here with my feet on the floor, hands behind the bed. Then
keep going.
Hands behind the head, and go into a back extension. So in doing so, I'm advising my client to contract their glutes, to draw their belly button to their spine, and then hold that contraction for a good 1 to 3 seconds. And then lastly, we have Superwoman 2, and you have to move up a little bit more on the balance trainer. Extending the arms and the legs, contracting the glutes, and then relax, contract, and relax. Now, both of these exercises put a lot of stress on the lumbar spine, but they also work to strengthen the core. However, if your client is at risk for osteoporosis, meaning they have osteopenia, or they have full-on osteoporosis in their lumbar region, do not do either of those two exercises. So this concludes the exercise component of your breast cancer recovery BOSU specialist course. You will now be able to take the exam, and upon completion and passing, you will receive your breast cancer recovery BOSU specialist advanced qualification certificate. Now that you've completed the videos that take you step by step through the exercises on the BOSU Balance Trainer, hopefully in combination with the material that you've read in the handbook, you feel capable of designing an individualized, comprehensive recovery program for breast cancer survivors, men or women. Remember that each and every person has a different response to treatment and surgery, and no two workouts are alike. Take your time. Don't worry about memorizing definitions, but figure out how to apply the information you've learned to working with the patients that you're going to see. You will have a 100-question test to follow. Take your time, read the questions thoroughly, and I guarantee you, you will be successful. There are no tricks. The information has all been presented in the video and in the handbook. If you are interested in learning about working with other cancer survivors, take a look at our Cancer Exercise Specialist Advanced Qualification course on our website at thecancerspecialist.com.